Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the role that hormones play in tick-borne illness in particular. First and foremost, if you have tick-borne illness, frequently your symptoms will become worse right before your menses and right before and during menopause. And that's due to the fluctuations in estrogen. For some reason, fluctuations in estrogen agitate the pathogenic organisms, and symptoms frequently will become worse right before menses, like cramping, headaches, migraines, migratory joint pain, things like that. And that actually is one of the ways that you can, one of those suspicions that when someone says that right before their menses, their symptoms are much worse, that's a clue. It's also a clue to endometriosis, but some endometriosis is also correlated with tick-borne illness. So that's really important. A lot of times, youth will find relief from getting on birth control pills. And I usually refer them to an OBGYN that is at least somewhat familiar with the role that tick-borne illness plays in regulating or dysregulating hormones. Low-dose estrogen birth control pill can be helpful to people. Menopause is a whole nother beast. So typically women will report feeling, just off. They're moody, they're fatigued, they're losing their hair, they have insomnia, they might have headaches. And, these are all things that are also seen in tick-borne illness. So, you want to be paying attention to, what is the risk factors for tick-borne illness in this patient? Does she live in an endemic area? Does she have animals? Do they find ticks on the animals? Things like that. Does she get a lot of mosquito bites? Things like that. And if that's true, then she should definitely be tested for tick-borne illness. And then depending on her genetic status, and what I mean by that is that, for example, my grandmother passed away of metastatic breast cancer, and my mom had breast cancer twice. So taking estrogen for me is a no-go, no matter what. I can't do it. So there are some tests that you can use. One is called the North Star, where they can look at several different genes, and I can't remember how many, maybe 50, maybe 100 genes. And they will be able to tell your genetic potential for different kinds of cancers. We know that Lyme disease is related to breast cancer. That's Neil Spector's work out of Duke. And it's quite likely that it's related to other forms of cancer as well. So it would be a good thing to know, what is your genetic potential for Lyme disease. Now, we've talked about this before. Just because you have the genetic potential doesn't mean you're going to develop the disease. That's governed by your lifestyle, what you eat, what toxins you've been exposed to, what infections you've been exposed to, etc. But in general, tick-borne illness symptoms get much worse at menarche and puberty for boys, and andropause and menopause for women. So I hope you found this information useful, and I hope you have a wonderful day. Take care.